silence. I'll tell you that I'm Andrea Barthwell, and I'm the president of board of directors of the Foundation for Opioid Response Efforts. FORE is the first national foundation to focus exclusively on the opioid crisis. And over the past 5 years, we have charted a course for impactful grant making. The next slide. Can you go to the next slide, please? The three-phase opioid epidemic has tragically proven that the market for substances of misuse is responsive to demand, is extremely nimble, and is increasingly poisonous and deadly. A balanced national strategy requires that we explore, we implement, and we integrate innovative solutions to prevent, intervene on, provide harm reduction services to treat, and to provide recovery support services for individuals with opioid use disorder. This morning, we are here to announce two important new grants focusing on our children. They are intended to promote a culture and an infrastructure that is better equipped to identify, to address adverse childhood events, which foster the feelings that promote use and the early onset of this childhood-acquired disease. These two new grants, next slide, please, number 99 and number 100 in our diverse portfolio, aim to activate and bolster two pillars of American culture. Sesame Street, a classic cultural icon, and the American Academy of Pediatrics, our nation's children's doctors. Next slide, please. To introduce the grantees, I'd like to invite Dr. Karen Scott, next slide, please, who joined FORE together with me at its inception, where she is president. This Harvard-educated and Johns Hopkins-trained physician has over 20 years' experience in healthcare policy, health services research, quality improvement, and public health. Her career has focused on redesigning care to promote health equality, health quality, patient safety at the macro level. She comes to us with the requisite experience to transform a system through philanthropy. Prior to FORE, she held senior positions at the Commonwealth Fund. She was on the board of Grant Makers in Health. And most recently, she was the chief medical officer in the Office of the Assistant Secretary for Health in the Obama administration. Please help me welcome Karen to the podium.
Thank you very much, Andrea. It is such a pleasure to be with all of you this morning, and welcome to our guests who are joining online as well. Fantastic to see a full room here to be part of our 5th anniversary and be part of this announcement this morning as we expand our work in the important area of focusing on children, youth, and families. Our work to date has included awarding 98 grants totaling close to $38 million to organizations across the country. And from the start, we have worked to engage a wide range of perspectives and experiences in our program development. We have used learning from our advisors and from our grantees to identify the types of projects and organizations that we can help support to have an impact on reducing overdoses and improving health. We are constantly asking, where can a small national foundation make a difference? That led us to first start with a focus on improving access to treatment, to evidence-based treatment, particularly for those populations most at risk for dying from an overdose, including those engaged with the criminal justice settings, pregnant and parenting people, those in very rural and remote areas, as well as those who were unstably housed. Projects under our Access to Treatment program focus on removing barriers and linking people with care. We announced those grants in March 2020. And as we all did, we quickly pivoted early in the COVID-19 pandemic to respond to what we were hearing as some of the gaps in services and the needs at that moment. we provided some quick grants and opportunities to support recovery organizations, as well as support a series of work to make sure that we were learning from some of the temporary changes that occurred during COVID. In 2021, we responded to the continual need for more timely and actionable data to address overdoses, as well as the need for more attention to addressing stigma. And we did that through our innovation program, bringing multidisciplinary teams together to work on these seemingly intractable issues in new ways. We then turned our inquiry to exploring how to approach prevention, recognizing that many of the same factors which support recovery also facilitate prevention. And one part of this is that communities need the resources to support building resilient, healthy families, including helping to mitigate the impact of adverse childhood experiences. Our family and community-based prevention program, launched last year with 11 grants over 2 to 3 years, is actually our largest program to date. And projects under this program are examining opportunities for school-based services. Some projects are integrating family supports into OUD treatment services. Others are training school staff about adverse childhood experiences. And yet others are providing children at high risk with healthy activities and screening for mental health needs. Today, we are announcing an expansion of our work focused on children, youth, and families. Our decision to expand our focus in this way comes out of a range of consultations and inputs, including a national advisory meeting we held this July. And it's driven by recognizing that after more than 2 decades, it's clear that this is a multi-generational public health issue. Focusing on younger children in families already affected by OUD, provides opportunities to change the trajectory of the next generation. And at the same time, we are seeing the sharp increases in youth overdose rates, particularly in the current high-risk environment due to the exposure of fentanyl. So we are thrilled to announce 2 additional grants, which expand our focus on children and youth and support the following projects: the Parental Addiction Initiative with Sesame Workshop, and the Pathways to Resiliency Toolkit with the American Academy of Pediatrics. We are also thrilled to mark our 5th anniversary this fall with announcing these as our 99th and 100th grants, bringing our total of committed dollars to just over $39 million, doing work across the country. I am now pleased to introduce our panel who will speak to aspects of this new work. Dr. Siva Kilamurthy is a child and adolescent addiction psychiatrist at the Children's National Hospital and Howard University here in Washington, D.C. Dr. Jeanette Bentoncourt is Senior Vice President for U.S. Social Impact at Sesame Workshop. Dr. Deborah Waldron is Senior Vice President for Healthy, Resilient Children, Youth, and Families at the American Academy of Pediatrics. And Lucy Battles and Dwayne Dean are both recovery coach professionals and also parents of both young and middle-aged school children. We will hear from each of our panelists in that order, and I'm going to ask Dr. Kilamurthy to start us off. Thank you. Yeah. Mm-hmm.
Hello, everyone. Good morning. It's my pleasure to be here. I thank Dr. Scott and the FORE team for the invitation. So I'm Siva Kilamurthy. I'm a psychiatrist by training, and I specialized particularly in child and adolescent psychiatry and addiction psychiatry. And I moved to DC in about end of 2021, and I started my work at Children's National, followed by my work at Howard University. Now, when I say child and adolescent addiction psychiatrist, it often confuses people who are not in the medical community. They often think about babies withdrawing from substances. It's very hard for people to fathom that kids middle schoolers and high schoolers can struggle with starting using a substance and going on to developing an addiction to a substance. So I'm here to speak to some of that. So since starting my clinic in 2021, we initially, expected to see kids presenting to the clinic with concerns around cannabis use and nicotine vaping. But we started noticing a change in trend. As you have seen, the overdose rates are going up, but also the kids presenting to treatment, the number of kids who are voluntarily presenting to treatment has also gone up. So about fall of 2022, we started noticing a significant increase in the number of kids presenting to our addiction program, asking for help with using fentanyl specifically. Now, this is unique because historically, kids did not come to treatment saying, hey, I'm struggling with marijuana, cannabis use, or nicotine use, right? Usually, when someone starts using a substance, it's often on a continuum. There are different factors that affects initiation and progression to a use disorder. But in this particular case, it seems that from the time that a kid initiates using these pills with fentanyl, the progression to substance use disorder seems to be quite quick, but also the time within which they realize that they have a problem and they need help has also kind of increased significantly. And also, this is still a small percentage of kids who are coming in for treatment. For every kid who comes in for treatment, they tell me about 10 of their friends who are not in treatment. But still, when these kids come into treatment, we are still struggling to provide them appropriate evidence-based care because those structures also do not exist. Or they exist, but we are in capacity. So there's a lot of capacity building that's needed. So, when I chose this pathway, the goal was prevention work. Mostly, I wasn't really thinking about building treatment programs because what we know in terms of the data trend is that substance use prevalence in kids has stayed the same or gone down depending on the different substances that are being used. But we quickly had to adapt to build the programs. And when I see these kids, it's kind of like, it's challenging work at the end of the day to help them get back on track towards recovery. But I would rather that they didn't have to come to the clinic in the first place, that we focus more on the prevention work and prevent that early initiation and progression. So I was quite excited and happy to hear about the initiatives when Dr. Scott reached out to me and told me about what FORE is doing in terms of their grants. So I'm quite happy to be here, and I'm looking forward to questions after. Thank you.
Thank you so much for being here. As I stand here, I really want to thank the insight of FORE, Dr. Scott, Dr. Barthwell, the board, the leadership staff that you all have, simply because today you have made a difference in how substance abuse disorders are being perceived. That this is just not an issue for adults, but rather that we need to look at this within the context of a continuum. We need to look at the impact and look at this as a societal issue that is impacting every family, every child, from birth, as well as communities, organizations, systems. And as we all sit here, we all know that there is some link to us personally with substance abuse disorders. I'm going to take back a little bit time and first introduce a little bit about Sesame Workshop. And sometimes as we were speaking with Dr. Scott and her staff, we were a little unusual, as you can tell. Somehow when you think of Sesame Street, substance abuse disorders, I'm not so sure, but there is a real rationale, and thank goodness for their insight. Let me introduce Sesame Workshop. We are a global impact organization whose mission is to help all children grow smarter, stronger, and kinder. And that means really fulfilling every area of young children's needs. When we say that, why do we have this mission? Because we use the power of media, We use the power of research, and we use the power of education and child development to really empower the next generations. But we also feel so strongly that the only way we can do that is with the philosophy that we hold of a circle of care. That means that every adult is a key influencer in young children's development. And in our discussions with FORE, we described that we are multifaceted in the work that we do. Most of you, and I'm going to do a little bit of an exercise, I'm going to ask you to silently close your eyes and think of a Muppet and a favorite moment. All right, I'm going to break your silence, open your eyes, and if I could turn the cameras, you'll all see a wonderful smile. And that is because you have a deep connection to our brand, our characters. It's also multi-generation. We connect with grandparents, extended family members, parents who now have grown up on Sesame Street, and now also their children are experiencing that. That connection is invaluable for us because not only do we produce an iconic program, I have the pleasure of overseeing what we call social impact. And what social impact is for Sesame Workshop is that we analyze where there are gaps in young children's development, where there are issues where young children's voices are silent, but yet these growing up topics, issues, and challenges are impacting their development. We know for young children experiencing, and you'll notice I use the term more parental addiction, even though we know it's substance abuse disorders, only because for children that is more concrete. We know for young children from very early on, when they are in a household, that someone is struggling with substance abuse disorder, and they are the main caregiver, they automatically have a lot of questions. They may not be able to express them, but they have many questions. Also, the impact of that connection that is so critical between children and adults, those nurturing connections often are not happening consistently. And we know that that foundation is so critical in young children's brain development. So what we do is we create impact resources that are research-based. We create them generally in English and in Spanish so that we can work with different organizations such as the American Academy of Pediatrics and others. And in this case, we will be having the pleasure of working with some other grantees as well, such as Morgan County and also the Denver Foundation, as well as the idea of All Rise. But that's not where we stop. What we do is we create these resources so that we create quality professional development to be able to embed in that circle of care and make an incredible difference to reduce stigma, bring awareness that this is just not an adult issue, that in order for us to counteract the effects, we must begin in early childhood. We must account there. We need to start at that point. We need to start also with the family. Lastly, as we go forward, one of the things that we believe is in research, and the pleasure of having two people here who are going to share the lived experience means that our work is based on what we hear from communities. And our goal is to bring that forward. As we go forward, all of you will be our partners, because each of you, as you're present here, hopefully through this experience, not only now, but throughout the entire experience of this event, you will need to see and recognize that we can't do this in isolation, that we need to unite, we need to bring our resources together. One of the things that we did is we created a wonderful Muppet by the name of Carly. Carly's story started the way many children are experiencing now, and that is she first entered foster care. And the reason she entered foster care was because of her mother's addiction. Thereafter, what we discovered that the biggest thing in our research for young children was that they often felt guilty that they were causing their parents' addiction as young as 3. It's something I did. I didn't behave. What we're doing is we're creating a sense of hope, a sense of awareness, and a sense of making difference holistically. We look to you as partners, and we are eternally grateful for this opportunity. Thank you so much on behalf of Sesame Workshop and the Muppets.
Thank you so much, Jeanette, for that overview of Sesame and for the discussion of Carly. And thank you to our parents for being here to present about your experience. And thank you to our child and adolescent psychiatrist for providing us an overview of what you're seeing in clinical practice. But most importantly, thank you to the FORE Foundation, to the team, and to the board for recognizing that the American Academy of Pediatrics can be a valued partner with all of you. On behalf of the AAP, I want to thank the opportunity to participate not only in this event, but thank the Foundation for their generous support. The AAP is a member-driven organization representing more than 67,000 primary care pediatricians, pediatric medical subspecialists, and pediatric surgical specialists. Our mission is to attain optimal physical, mental, and social health and well-being for all infants, children, adolescents, and young adults. With an increasing rate of overdose deaths among our nation's young and young adults, and the surging prevalence of fentanyl heightening the risk, it is crucial that efforts to prevent, identify, and treat substance use among adolescents are improved. We feel that pediatricians and pediatric clinicians are well positioned to support youth, but many of them need additional resources to better address opioid use disorder in our primary care settings. Leveraging the Academy's vast network and expertise, we will advance strategies that address the opioid crisis among adolescents and young adults. With support from FORE, our project, Pathways to Resilience, pediatricians addressing substance use among adolescents and young adults will improve the prevention, early identification, and treatment of substance use among adolescents and young adults by strengthening the capacity of pediatricians and pediatric health providers to care for them and their families. A brief overview of what our project will be doing is we will support a variety of activities to meet our goals and objectives. First, in a couple of weeks, we will have a 1-hour educational session titled Keeping Children, Teens, and Families Safe from Fentanyl. This will occur at our national conference and exhibition, which will occur here in Washington, D.C., and we're happy to say that almost 10,000 individuals have already registered for the event. We will also develop an advisory board to support the implementation of our activities. The advisory board members will have a wide background, and they will include not just pediatricians, but also non-physician clinician representatives, our governmental, educational, and other public health partners. And critically important, we will be including adolescents, young adults, and family representatives with lived experience. We'll also be engaging some of our chapters. 6 AAP state chapters will be involved in a learning collaborative. And specifically, that aim is to improve substance use screening and referral rates for our adolescent and young adults aged 11 to 21. We are going to target states that have higher prevalence of overdose and overdose death. Dr. Scott also mentioned our toolkit, and that will soon be posted on our Academy's website, aap.org, and it will have resources to address stigma, as well as other barriers to care, and will contain samples of conversation starters, case scenarios, infographics, video, and other digital media. We're also going to host town hall meetings. They'll be focused on substance use and overdose prevention in adolescents and young adults. We've had much success with hosting town hall meetings, specifically on topics of COVID-19, mental health, and children and youth with special healthcare needs. Most importantly, we're going to have periodic updates on the overdose and overdose deaths in adolescents and young adults. Similar to the Academy's experience in working with CDC to extract pediatric-specific surveillance data, we will engage the CDC to identify data sharing mechanisms to track these deaths, as well as the overdose. And we will also design periodic updates to share with applicable metrics. We also plan a broad promotion of our numerous policy and resources on substance use and prevention to our different constituents. So what will success look like? Overall, we expect hundreds, if not thousands, of pediatricians to attend our upcoming conference. We want to strengthen existing partnerships and forge new relationships with partners such as Sesame to work on these important topics. And we also want to engage our chapters, the boots on the ground, really working in those states which have been hardest hit by the opioid epidemic. So we are going to strengthen pediatric competencies to identify substance misuse and customize the SBIRT, the screening, brief intervention, and referral to treatment methodologies so that they will be part of what adolescents and young adults are using in terms of their health and well-being. We're going to increase the pediatric practices competencies as well as capacity to address this important public health need. Secondly, we're also going to improve the capacity of the American Academy of Pediatrics to inform pediatricians and other pediatric professionals about the trends and true emerging threats regarding opioids and the risk of opioid misuse. And third, through collaborative partnerships, we're going to enhance our capability to use communication and information technology to affect health decisions and actions regarding opioid misuse and overdose. We're eager to launch this important project. And again, we thank the FORE Foundation for this efforts and this opportunity to partner and advance innovative strategies that address the opioid crisis among adolescents and young adults. And we hope to see many of you at our conference in a couple of weeks. Thank you so much.
Hello. Thank you to FORE and to Sesame and AAP for allowing me space today to share my story with you all. When Sesame was asking what our puppet was that we thought of, I thought of Grover, that lovable blue guy who just couldn't get it together, but he kept trying. That reminds me of my own story. I'm a mom of 3 girls. My oldest is 12. I'm also in my 12th year of recovery from opioid use disorder. I had been in a perinatal treatment facility for 27 days when my daughter was born. But my substance use started well before that. I was a teenager struggling with alcohol use disorder. And then when I went to college, I was prescribed Percocet for a dental procedure. And for the next 4 years, I used daily. When I found out I was pregnant, I was terrified to stop using. Drugs had become my best friend, my only support and outlet. At my first prenatal appointment, my partner, who was also in active use, told the providers that I was abusing opiates. As a result, the nurse and the doctor completely shifted their questions to him. All communication was directed to my partner, as if I was no longer present in the room. Instead of receiving congratulatory remarks and information, I was admonished. I was told to stop using and reminded that I was hurting my baby. I was angry, embarrassed, and discouraged. In that moment, I wanted to scream, "Who's going to help me? Where is the concern for my life?" I never returned for any prenatal care. Guilt and shame fueled my addiction. I continued to avoid feelings by using alcohol and drugs. The drugs brought me to bottoms that I never could have imagined. I experienced homelessness, I resorted to criminal activity, and I put myself in extremely unsafe conditions. When my criminal activity finally caught up with me, I was pressured into entering a treatment program. Many times during my recovery journey, people have asked, "How did you do it? Why did you stay?" And it was their trauma-responsive care. The providers used recovery-centric language. I wasn't an addict. I was a mother with opioid use disorder. I was a mother. That was an identity that I struggled with the entire pregnancy. We worked to build the relationship between my daughter and I so that I could parent from a place of empowerment instead of a place of guilt. And it was the constant access to resources and peer support that helped me build connections with women who had been in my shoes and who had found a new way to live. As a mother in recovery, this project is very near and dear to my own heart. I know that children who have parents with a substance use disorder have increased odds of developing a substance use disorder themselves. This funding will not only save countless families, it may one day save my own. I work with youth and their families who are impacted by substance use and mental health crises. The opioid crisis is in all communities, and it does not discriminate. Sesame Workshop has done incredible work to eliminate stigma around substance use. When my own children come to me with questions about my recovery story, I know where I can turn to get appropriate resources to guide our conversations. The AAP will save countless lives by tackling the opioid crisis from a prevention lens. By arming pediatricians and young people and their families with resources and strategies to decrease use and encourage open conversations, they will be creating a safe space for youth who need support. It is this caring and compassionate approach that led me here today. I am thankful for the innovative organizations like FORE, Sesame Workshop, and the AAP for fostering resilience in recovery communities.
First of all, I want to thank Karen, Dr. Scott. When Dr. Scott calls, I go. And it's because I know we're ready to affect some change, and it's a given. I thank all the panelists that spoke before me, and I appreciate it. My story. I use substances in one way, shape, or form for 27 years. I actually, in 2 weeks, I'll be coming up on my 10th year of sobriety. But I go a little further back, and I remember I had questions way before I took my first drug. And the way the culture, the way things were handled traditionally, it was certain questions that if I asked my mom, and believe me, my mom did the best and was the best, one of the best moms, it was certain questions that were not answered. They were not answered. It was don't stare, shh. And because of that, one thing I realized is as a child, we're gonna learn even if you don't teach us. We're gonna learn. And it's funny because the other day, and I was just talking to one of the panelists earlier, I was in my car and my daughter, I have a 2-year-old daughter, and she says to me, "Daddy, I sad." I'm like, "You're 2, what could you possibly be sad about?" And she said, "I sad." I said, "Okay, Monroe, what is wrong?" She said, "I left my sippy cup." Of course, I'm a daughter dad. I put my blink on, make the U-turn, and I know to go get that sippy cup. I know better. I'm conditioned by now. Go get the sippy cup. But she recognized that she had some feelings. And I know that I didn't teach her yet about feelings. Sesame Street has a show with Elmo, and it talks about mental health. It talks about noticing, feeling, and that you can. I notice, I feel, I can. And when we're talking about substance use disorder, it is prevalent. It is our new reality when it comes to the opioid epidemic. It's our new reality. Our children are begging for bread and have no one to break it for them. They have questions. They notice they have questions. We have to help them understand because they're gonna learn, even if it's not from us. We need to guide, direct, and feed them. And I say this because I'm a new parent. My first child, I'm about to turn 50. And I have a 2-year-old. First of all, pray for me. Whew, pray for me. No, literally right now, pray for me. No, I'm just kidding. But she's a sponge right now. And she has questions. And one thing I realize is that if your why is big enough, you'll find out your how. And that's why when I get that email, I see it's Dr. Karen. I'm like, okay, let's go. I strap up, let's go, because I know we're gonna go affect some change. The stigmatization of addiction and recovery and everything that's around that realm is really prevalent right now in our society. And we have to, as a society, as a people, as we have to change the narrative. We have to talk about and have those hard conversations, especially with our youth, because they're curious. They want to know why, and we have to change the narrative. Let's talk about it. I think what Sesame Group is doing, what Sesame Work Group is doing is awesome. It's awesome. They're talking about, they're having this hard conversation, they're finding the gaps and they're discussing it. And they'll help us be able to have that conversation. So I can have the conversation with my 2-year-old, with the youth, because they're coming through the ranks. And they're going to be our next presidents, our next officials, our next doctors and nurses. When I came through my substance use disorder, I didn't have any, before I even started taking substances, and I was curious, I couldn't have the conversation about it to know how, dangerous it was. We have to change the narrative. So I really appreciate that Sesame Work Group is taking this initiative and talking about those hard conversations when it comes to mental health, those hard conversations when it comes to substance use disorder. Y'all told me, or I was told when I was in school, that an ounce of prevention is worth a pound of cure. Let's not be reactive. Let's start being proactive and having these conversations. Thank you.
Now you see why I called Dwayne often. And you've just earned your the right to make sure that I call you again. So thank you so much. Amazing comments. Lucy, thank you so much for sharing your story and your comments and really putting the emphasis on why we're excited about this work and excited about these announcements today. And Siva, Jeanette, Deborah, thank you so much for your comments and for really bringing the projects to life for us. We do have a few minutes for some questions, and I'm happy to get that started and take any questions from the room. And Ken, our program director, will also let us know if there are any questions online. Yes. Do you want to introduce yourself and then say?
I'm so incredibly grateful for the work that you do on a regular basis. As a young person in recovery, my only options were adult serving programs. So I know intimately how needed you to service you are. And I'm really grateful to hear the language you're using. It's very recovery centric. My question is, how are you at all utilizing peers for these services? You're going at it, you're not doing that work, and you are you going to research it? All partners with the local patient recovery programs.
Thanks a lot for that question. So we have thought about it. The challenge is, the time when kids are kids, right? So when I see my patients in my clinic, they're 16 years old, they're 17 years old, and they have, they're just entering treatment, and it often takes time. So by the time that I'm able to think about them as having been in treatment and recovery for long enough to act as a peer, they're often older. And then the challenge becomes, do I want a middle schooler or high schooler connecting with someone who's much older? And would that still count as peer support? Maybe it does. But like I said, my clinic, we started in 2021, and I'm not there yet in terms of identifying peers that I feel would make a great fit for someone else in my program. But there's a constant thought. We want to bring kids in recovery into the conversation. When we work with the local school systems, we often ask if they ask for input from kids who are in recovery about the initiatives that the schools are taking. And I often ask my kids and my patients in my clinic about what they think we can do better to help them stay in care and engaged in care. So it's a work in progress. But that also brings us to parent peer group as well. That's something that we are more, something that we're working on right now is, can we engage like a parent support system where parents act as peers to other parents to help their kids engage in treatment.
Okay. Thank you. Thank you, sir. Other questions? Yes.
Oh, thank you. Good morning, Dr. Andrew Wilkinson with Child Trends. I also have a question for Dr. Murthy. I'm curious, you said when you started the clinic, you were really excited to focus on prevention, and then whoops, a lot of treatment services are needed. Has serving youth informed your, I bet you have profound insights into what coherent prevention would look like. If this is how youth get here, boy, we need X, Y, and Z to prevent them from entering the doors in the first place. I'd be curious to hear your insights.
So in our work with the school systems, we often start off with what does their substance use curriculum look like? Like what age does it start? And we know that, so for patients entering treatment in my clinic, on average, they're entering treatment at about 16 years old. And that's mostly for opioid use, right? But they've been using nicotine products or cannabis products since middle school. So we need to start even before that. And so I think the challenge is like, what are some shared vulnerabilities in kids who are more likely to start, initiate, and go on to have a problem? And trauma is one of the biggest shared vulnerability or risk factor. And I was glad that, they're working on resiliency, and building resiliency is going to be key. So I think starting quite early, and it's never too early. And I often, when I talk to parents, I tell them, how can we model behaviors? Because they're more likely to do what we do than follow what we say. So those would be things that we tend to focus on more.
Thank you. Thank you, Deborah.
If I may, from the perspective of the American Academy of Pediatrics, that's a great question, because we hear a lot about adverse childhood experiences, but there also are positive childhood experiences. And what are the things that are going well in a family's life, in a child's life, in a youth's life? Where's the father who goes back and gets the sippy cup? How do we actually build that circle of care that Sesame is talking about? So it's starting early, it's starting in utero, it's starting prenatally to make sure that those children have the best start as possible. And I'm sure that Sesame has something to say as well.
My goodness, it's like speaking our language. I think as we're looking, one of the things that we found in our research initially, and when we produced our initial resources, was where young children often turn to in terms of asking questions. A lot of times it isn't the parent or the caregiver, because they're realizing very early on the stress that the parent and caregiver, they're going outside. And we found this burden on the early childhood community. Children were coming in, experiencing their own trauma, but also asking questions about what was happening at home. We created something very typical, a storybook. It's both digital and in hand, to help early childhood systems and educators to be prepared on how to respond. The reason I bring that up is because nurturing connections in early childhood are based on many, many points. One, obviously, are parents and caregivers. But if the parent is going through their own trauma, their own difficulties, a child needs those nurturing connections from others. So the goal here that I think is so wonderful that FORE is establishing for all of us is how to make those connections, that language, that reduction of stigma across the board in all touch points. Because if we don't align in that way, then AAP could work, we could work, but if we don't align and have that consistency, and it's you're saying, look at those trends and touch points.
Thank you so much. And we do have a question from online. Ken?
Yes. This is from Connie Matheson. Can AAP talk a little more about how pediatricians will approach youth to talk about SUD under the new program?
Sure. Thank you. That's a great question. So obviously we recognize that the children are coming to pediatricians' offices, and they may not be as well prepared as they should be and have the capacity and competency to have those questions. So we are actually going to work with our advisory board to develop what are the best practices that can be embedded within the four walls of a clinic. But as we talked about, we also talked about working with our chapters as well. And we recognize that the problem does not exist just within youth that show up within a clinic, and being able to work with our pediatricians that do both programmatic work and advocacy work at the local and state level to help build the processes and programs around children that help support them better.
Thank you. I wonder, while we're waiting for another question, just to add on to that, I wonder if Lucy and Dwayne, as we spoke with both Jeanette and Deborah, from the foundation perspective, it was certainly very important for us to both make sure there were going to be ways of getting the voices of youth, of adolescents and young adults into the work, as well as parents. And I wonder if Lucy or Dwayne have any comments around what are the best ways for projects like these, organizations like Sesame Workshop and AAP, to be reaching out to parents in recovery, to make sure they are engaged in a meaningful way in developing this work.
I think it's important to hold community listening sessions, get people engaged, find out who your stakeholders are. And I always know that my daughter's pediatrician also, they give space for us to ask questions. They send us notices all the time. Do you need this? Do you need that? Asking those open-ended questions, inviting parents and children in to have deeper conversations, showing that that real concern and compassion has been really helpful for both myself and my daughter, so that we can have those experiences. We can ask questions without the worry of judgment. Providing a trauma responsive space. My team knows what I've been through in life, and so when I go into visits, they're prepared. They know the things to say that will keep me engaged. I think having that approach when dealing with young people is so important. Young children, like Dwayne said earlier, they're sponges. They take everything in. And so keeping that in mind when working with them, just allowing them to soak up as much information as possible. It's never too early to start, in utero. We start preparing them when they're infants. My children have been going to recovery meetings with me since birth. They don't know what we're saying, but they know it's a lot about drugs and alcohol and recovery. So if we start having those conversations without worry of shame and judgment, and making it something that's commonplace in our society, then they'll be more prepared to have those conversations in safe spaces at their pediatrician's offices.
Thank you. Dwayne?
Yes. One of my biggest faults is I shoot straight from the hip. I believe we've done the research. I believe we have the data. We know the tools that are effective. Courtney just spoke about peer recovery coaching. We have people with lived experience that walk the walk, that have experience in addressing the population. We have young people in recovery. We have young peer recovery coaches. We've done the work. We've done our work. We have tools. We know what's effective. We have to utilize it. We have to utilize peer recovery coaching and specialists in primary care. And we have them in the emergency department. We have them in community centers, medication for opiate use disorders, the schools. We have in the education system. Utilize the tools that we have. So we have some and they're proven effective. by the research that we're doing. Their tools have been proven effective. And we show that they're effective in so many different ways. So I believe let's figure out what ratchet or what socket we need for this nut here. Because we have the tools. We got to go back into the toolbox. Thank you.
Well said. Well said. And I think we had another question from the audience.
I'm Pamela Sessions. I'm the CEO at Renewal House in Nashville, Tennessee, and of course, a previous FORE grantee. So we're excited to be here with you guys today. I want to take this panel home with us so we can spend a lot of time talking to you. Dr. Waldron, we are service providers, and I was curious what your thoughts are on how we could connect better to our pediatricians and medical professionals to help the families that we are working with. Certainly, as a social service provider, we don't want to come off as being offensive to a physician or a nurse practitioner. So can you give us some guidance on that?
Sure. Thank you so much. It's a great question. Actually, the work that we do in my area has a strong community focus. We recognize that team-based care is the only way that we're going to make a difference, and that team is not just within the four walls of the pediatrician's office. In many of our programs, we work with our early childhood providers, we work with our schools, we work with our community providers on building that, I don't want to call it a safety net, but that connections and that network to help build stronger children. So many of our chapters do model that, our state chapters do model that in the work that they do. And the Academy at the national level also works with partners in different sectors that have a vested interest in children's health. So we'd be more than happy to talk to you later today about the work that you're doing and opportunities to be better engaged. Thank you.
Wonderful. Thank you. It's wonderful to have our former grantees as well as our current grantees here. You'll never be a real former grantee. We keep everyone in the FORE family. So, do we have any more questions, Kendra? Mm-hmm. Thanks, Ken.
Thank you. So this is a question around, I think, transitions and basically from adolescent to young adult to that adulthood. And so one of the questions here is there a dimension of the focus on prevention efforts for children, youth, and families in which higher education institutions could add value? So if it has a place, how do you envision, partnering with universities around that transition for young adults?
Sure, I can go first. I'm hoping that Sesame actually has something for college students in secondary education. I would join. That is important because obviously we talk about the 11 to 21-year-olds, but we recognize that the adolescent and young adult brain does not actually fully develop till 26. And being the parent of young adults, I would say 35 or 40. But no, seriously, we need to make sure that the systems that we build in early childhood and middle childhood and adolescence actually carry over to support our adults through workplaces. So not just through secondary education, but through those opportunities where we know that our adolescents and young adults are heading. The military, there are many different places where we actually need to keep our tentacles. And pediatricians really do care for individuals well into their young adulthood. So it is an important question because we can't just forget about kids when they turn 18. They may become adults, but they really are still part of our society. And I don't know if others have said that.
I will say that our sweet spot is a little bit younger. That said, looking at higher education systems, one of the approaches that we take is what is that circle of care when we talk about systems? And we know that particularly in community colleges, the number of young parents that are there. And so we actually work in that network as well to be able to, again, introduce these resources, both at the college level in terms of its systems and support services that often do include social services and others, as well as directly into accounting how the community college young parents or sometimes slightly older parents actually link to the early childhood system in their network. And right now there's a big movement within community colleges of aligning these systems. And so once again, I just stress that the advantage that we're looking at here is how to make sure that we're creating a map of systems where this information, this approach, and this alignment is most important.
Yeah. Siva, did you want to add to that?
So, I mean, I'm just thinking about my patients who are turning 18 or graduating high school, and the prospects of college does not exist for some of them, but many of them are going on to trade schools. That seems to be very realistic for them. And I think the conversation have always been around recovery. What does recovery look like as they transition? So even within the school systems, like, there are concepts like recovery high schools. And how do we think about that for higher education and even subsequently workplace? Thanks.
Thank you. Thank you all. Oh, we have one more question. We have time for one more question.
Go ahead.
Hi, this has been a wonderful panel. I want to talk about the music industry, the entertainment industry that pushes this message. You take drugs, Molly Percocet. I mean, it's all over the music. So it seems that we need to have the entertainment executives at the table for them to really understand what we're doing at the grassroots level, but they have a much higher view and influence on these young people.
Great. Thank you for that comment. I think as we're continually trying to think about how we do expand the network and where those leverages are. And at the National Advisory Council meeting we held on these issues in July, certainly a strong theme was around the messaging and the messengers and how to really effectively get out messages, and lots of examples of what's not effective messaging when you're talking to adolescents today. So thank you for that. And did we have one more question?
So hello, I'm Ariana Campbell. So I'm a PA. I work in an emergency department, and I also work in a bridge clinic, and I am from the bridge program. So we're a grantee. Dr. Baldwin, I have a question for you. Often I am seeing kids, so adolescents who have opioid use disorder and need access to medications. And there's a lot of barriers to them getting medications. We've worked really hard in emergency departments and in fact have done programs through pediatric emergency departments all over California to really try to close this gap. But I'm just wondering if you're, with one of the very first people I talked to in my work at my hospital was one of the pediatricians who joined my substance use disorder committee. I am wondering if you're going to do some projects just to disseminate more information about medications for opioid use disorder to pediatricians.
That's a great question. And actually part of our resources will be using the existing AAP policy, specifically about MAT, about opioid use, about fentanyl, about buprenorphine, all of the things that you mentioned. The Academy has a wealth of experts on our Committee on Substance Use and Prevention that has developed a number of educational resources. Plus, at our national conference, while FORE Foundation will be highlighted with the work that we're doing here, we also have a number of sessions specifically talking about that. So we have multiple opportunities to improve the access to medication, but also providers' comfort level with using prescribing that medication. So it's a great question. Thank you. And also to make sure payers pay for it.
Thank you all so much. This has been such an exciting morning for us, for the foundation. And we're so grateful to our speakers, to our panelists today, to all of you for being here, as well as for our audience online. I want to just ask you to thank our panelists once more. Really great. And just a reminder that we've got a number of resources on our website. Should be there. Our media kit for the press with speaker bios, photos, the press release, which came out this morning on the projects, is all available on our website. Press can also contact us now or in the future through our press lead, Myrna Manners, who's here in the room. And again, you'll be able to view a recording of this program as well as related resources online through our website. We look forward to hearing from you. We are going to continue our celebration today of marking our 5-year anniversary with convening all of our grantees in about an hour to begin the rest of the day and a symposium to really focus on how we now accelerate the work that we've been able to fund now 100 grants, $39 million. But how do we start to work together to accelerate this so the next 5 years look quite different than the last few years have looked? So thank you all for joining us this morning.
Thank you.
Great. Thank you. That was amazing.